triceps brachii has 3 heads. The long head attaches to the infraglenoid tubercle of the scapula. The lateral head attaches superior to the radial groove on the posterior surface of the humerus. The medial head attaches inferior to the radial groove on the posterior surface of the humerus, and the medial head is the workhorse. All 3 heads of the triceps brachii distally attach to the proximal end of the olecranon process and fascia of the forearm and subtendinous olecranon bursa. Anconeus attaches to the lateral epicondyle of the humerus and the lateral surface of the olecranon and the superior part of the posterior surface of the ulna. Brachioradialis attaches to the proximal 2/3 of the lateral supracondylar ridge of the humerus. It distally attaches to the lateral surface of the distal end of the radius. Extensor carpi radialis longus attaches to the lateral supracondylar ridge of the humerus along with the brachioradialis. It also attaches to the lateral epicondyle. Distal attachment for extensor carpi radialis longus is the base of the second metacarpal bone on the radial side. Extensor carpi radialis brevis attaches to the lateral epicondyle and then distally attaches to the base of the third metacarpal bone on the radial side and has a slip to the second metacarpal. Extensor digitorum attaches to the lateral epicondyle of the humerus and extensor expansions of the medial 4 digits. So it has a median slip to the PIP, 1 median slip, and then 2 lateral slips to the DIP. Extensor digiti minimi attaches to the lateral epicondyle and then goes down to the fingers and attaches to the extensor expansions of the 5th digit, and it divides into 2 tendinous slips just like the extensor digitorum. Extensor carpi ulnaris attaches to the lateral epicondyle and the posterior border of the ulna. Its distal attachment is the base of the 5th metacarpal bone on the medial side. Supinator has lots of attachments. He attaches to the lateral epicondyle of the humerus, the radial collateral ligament, the annular ligament, which wraps around the radial head, the supinator fossa, which is there, and the supinator crest, which is there. The distal attachment is the lateral, posterior, and anterior surfaces of the proximal 1/3 of the radius. Abductor pollicis longus attaches to the posterior surface of the ulna and radius, as well as the interosseous membrane. Distal attachment for abductor pollicis longus is the base of the 1st metacarpal bone. Extensor indicis attaches to the posterior surface of the ulna and interosseous membrane. Its distal attachment is extensor expansions of the 2nd digit.